What is coronavirus? Coronaviruses are a type of virus. There are many different kinds, and some cause disease. A newly identified type has caused a recent outbreak of respiratory illness now called COVID-19. Lauren Sauer, MS, the Director of Operations with the Johns Hopkins Office of Critical Event Preparedness and Response and Director of Research with the Johns Hopkins Bio Containment Unit, shares information about COVID-19 and what you need to know. How is COVID-19 spread? COVID-19 can be passed from person to person through droplets from coughs and sneezes. COVID-19 has been detected in people all over the world and is considered a pandemic. The spread of this new coronavirus is being monitored by the Centers for Disease Control, CDC, the World Health Organization and health organizations like Johns Hopkins across the globe. How did this new coronavirus spread to humans? COVID-19 appeared in Wuhan, a city in China, in December 2019. Although health officials are still tracing the exact source of this new coronavirus, early hypotheses thought it may be linked to a seafood market in Wuhan, China. Some people who visited the market developed viral pneumonia caused by the new coronavirus. A study that came out on January 25, 2020, notes that the individual with the first reported case became ill on December 1, 2019, and had no link to the seafood market. Investigations are ongoing as to how this virus originated and spread. What is the incubation period for COVID-19? It appears that symptoms are showing up in people within 14 days of exposure to the virus. What are symptoms of COVID-19? COVID-19 symptoms include fatigue, fever, dry cough. Some patients may also have aches and pains, runny nose, sore throat, shortness of breath, diarrhea. In rare cases, COVID-19 can lead to severe respiratory problems, kidney failure or death. If you have a fever or any kind of respiratory difficulties such as coughing or shortness of breath, call your doctor or a healthcare provider and explain your symptoms over the phone before going to the doctor's office, urgent care facility or emergency room. Here are suggestions if you feel sick and are concerned you might have COVID-19. If you have a medical emergency such as severe shortness of breath, call 911 and let them know about your symptoms. About coronaviruses. Coronaviruses are common in different animals. Rarely, an animal coronavirus can infect humans. There are many different kinds of coronaviruses. Some of them can cause colds or other mild respiratory, nose, throat, lung illnesses. Other coronaviruses can cause more serious diseases, including severe acute respiratory syndrome, SARS, and Middle East respiratory syndrome, MERS. Coronaviruses are named for their appearance. Under the microscope, the viruses look like they are covered with pointed structures that surround them like a corona, or crown.